like Ms. Price said, I started back at Coosa Valley in January of 2004 through the Aggie Ball program, which allowed students from the school system to come and volunteer and to earn credit, but also giving back to their community. And also I found out that I wanted to be a pharmacist through this process. I had an interest in the medical field, and that kind of did it for me. Former director of pharmacy, Mr. Charles Ousley, was the director of pharmacy at that period of time, and he was gracious enough to let me into his pharmacy to, learn from him and the other pharmacists, and my love of pharmacy took off from there. And I've kind of come full circle, and I'm now back at Coosa Valley serving as the director of pharmacy at the hospital. So one thing I wanted to go over with you is our mission statement at Coosa Valley. I'm just going to read it to you. Coosa Valley Medical Center is dedicated to providing our community with comprehensive health services that enhance the health and wholeness of each individual we serve through medical and spiritual support while affirming their personal value and dignity. So I can speak on behalf of our team members at Coosa Valley is when we come to work every day, that's what we're trying to achieve. We want to take care of our patients the best way we can, and we also want to be able to meet them at their point of need. So to me, that was an important thing to relay to you guys and to tell you, that's what we strive to do every day when we walk into the four walls of the hospital. Just to give you a little bit more information about myself that Ms. Price did as well. I am a resident of the Sylacauga area of Wetumpka, outside of the years that I spent down in Auburn going to school at Auburn University. Like she mentioned, I'm a 2004 graduate of Sylacauga High School. I graduated from the colleges in science and mathematics from Auburn University in 2008, earning a bachelor's degree in biomedical sciences. Following graduation, I entered into the fall of 2008's pharmacy school class at the Harrison School of Pharmacy, and I earned my doctorate of pharmacy degree in May of 2012. Picture there is myself and my wife, Meg Griffin Morris of Talladega. She, you may be kind of familiar with her last name. Her family owns Griffin Jewelers in the area. And we are both members of First Baptist Church at Sylacauga. And I am active in the Sylacauga Kiwanis Club, where I currently serve as the president and also as the treasurer. That sounds like a lot. Well, it is. Well, they wanted me to be the president. I was happy to serve, but I've been the treasurer since 2013 and didn't really want to give it up, because if I had to give it up, I just have to take it back in a year or so if I was willing. So I said, I'll just do it and be the president as well. So I'm doing that. And I've been back at Coosa Valley since January of 2019, serving as the director of pharmacy. So just want to go over, what is pharmacy? Pharmacy is defined by Webster as the art, practice, or profession of preparing, preserving, compounding, and dispensing medical drugs. So what does a pharmacist do? You all know that we are the dispensers of the medication. From the hospital side, the physician sends in a physician order, or the community side, the physician writes a prescription. And the first thing that we have to do when we receive these orders or prescriptions is first identify, is it appropriate for the patient? Is what this physician ordered the right thing for you from many standpoints? If it's a child, is it the right dose? Is it the right duration of therapy? Is it, if it's a drug that affects your kidneys, is it the right dose for your kidneys? So we have to determine many things before we move forward in dispensing that prescription or filling that order. From there, we perform clinical monitoring. We look for drug interactions, things that could, if the new order could potentially interact with another drug that you are currently taking. We also have to monitor for disease state interactions. Just say, for example, if you have Parkinson's disease, there's a group of drugs that you cannot take because it will make that disease state worse. So we have to look out for all of those things and identify those as prescriptions or orders are written. And once you're put on a particular medication, especially from the hospital side, we can monitor drug therapies and how they progress and provide interventions when appropriate. We also advise the medical staff and your doctors on how to select and how a drug will affect you in many different ways. Since I work more on the hospital side, we do a lot of compounding medications, especially from the standpoint of sterile medications, sterile compounding. A lot of times, IV antibiotics have to be compounded because they're not stable, meaning they don't, once it's mixed, they're only good for so long. So we have to mix those in a sterile environment at the hospital to be able to provide those to you. We also counsel patients when necessary and when new prescriptions are ordered. We also provide immunizations. If you haven't gotten your flu shot, please do so. I think the CDC is recommending to go ahead and get those now rather than wait because it's potentially going to be a bad flu season. Other vaccines that you might get from a pharmacy is shingle shot, pneumonia shot, tetanus shot, among many others. And we also have to comply with many state and federal laws. So one thing that I wanted to mention with you today is the pharmacy profession has been advocating for a collaborative practice agreement for quite some time. And Alabama was the 49th state to enact this, so we're proud that we're finally there. It was a bill that was introduced this past legislation session by our very own Ron Johnson and Senator Tom Butler, both who are pharmacists. This legislation was signed into law by Governor Kay Ivey, and it became effective last month. So to tell you a little bit more about what this means, it allows a pharmacist to enter into a collaborative practice agreement with a licensed physician, which will improve patient outcomes and access to care. And as we learn more about this, we can, in the coming years and months, we'll learn more about how we can be more effective. But what this is huge for is especially patients that live in rural and underserved areas. I heard a statistic just the other day that we all know there are 67 counties in the state of Alabama. 56 are considered rural, and 54 of those 56 report a doctor shortage. We're very fortunate that we have Coosa Valley here with our great medical staff because we're just added 2 great physicians. I think one that spoke a couple months ago, Dr. Jonathan Overcash, who's a general surgeon, and Dr. Emily Allen McInnes, who is from this area. I went to high school with her. You might know her mother and father, Joe and Tracy Allen. She's the new OBGYN that started a couple of months ago, and we're very proud to have her on staff. So we're actively recruiting physicians and look forward to taking care of our area for a long time. One important stat that I wanted to mention about this is why this is very important from a pharmacy standpoint is 90% of our U.S. population lives within 2 miles of a pharmacy. So since we have a doctor shortage, this is going to be huge for our patients. And as we know, baby boomers are getting older and already make up 25% of our population. And by 2030, 20% of our population will be at least 65 years of age. And that's very important to note because seniors are the ones who typically take more medications. So we're looking forward to this and looking for this was a huge win for pharmacy and looking for how this will affect us down the road. And this is just the ceremonial signing of HB 35, and I think we all know this fellow right here. So Representative Johnson, who was one of the co-sponsors for this bill. So getting more into the topic of today, get it to advance. There we go. Medication safety. Typically, medications are safe when they are used as they are intended to be used and how they are prescribed. We all know that you take medications to treat various different things, disease states, be able to manage conditions and relieve symptoms. But no, there is risk with taking any medication. And that's why it's important to have a good open dialogue with your pharmacist and be informed. We want you to know what medicine that you're taking. A lot of times we hear at the pharmacy, it's the little round white pill. Well, there's 250 little round white pills in most any pharmacy. So we want you to know, if possible, what the little round white pill is that you're taking. And we want you to be informed and ask questions when you have them. Pharmacists are the drug experts. We have to go to school just basically as long as a physician does. We do undergraduate work, and then we go to pharmacy school for 4 years. So we are trained for 4 rigorous years on medications and how they work and how they interact with other things. So utilize pharmacists. We're there. We want to help you. And it's our responsibility to also help you to prevent adverse drug events. It's important to note that 82% of Americans take at least one medication, but 29%, more than a quarter of the population, take 5 or more. So when you start taking more and more medications, there's more potential for adverse effects, and we want to help you to prevent that from happening. And the sad thing is that adverse effects are likely to grow because we're inventing new medications. We're learning more and more about the ones that have been around for a long time. As I said earlier, our seniors typically take more medications, and we have an aging American population, and the expansion of insurance allows for more prescriptions to be written. We want you to participate in your care. It's a joint venture between you, the doctor, and the pharmacist. We want you to be involved. We're trying to help you and have a better life for you. Make sure to follow the directions that your pharmacist or your doctor gives you. And if you don't hear anything else from me today, hear this point. Make sure that you keep a list, and make sure that list is current of all your medications, whether that's prescription, over-the-counter, herbal supplements, any kind of supplements, and know what strength they are, know how often you take them, and why you take them. And you say, just for instance, you use Dr. Garris for your primary care doctor or Dr. Davis, and make sure his list is up to date with what you take. And if you see Dr. Dotson for your cardiovascular, your cardiologist, make sure those lists match, and make sure that they both know that what you're taking, so that can help to prevent any kind of problems with your drug therapy. And always read the label and make sure that you're taking your medicine as prescribed. I always like to tell people, make sure that you read the label and understand it before you leave the pharmacy or call back, because we sometimes try to fit a lot of information on a little bitty label, and sometimes things get abbreviated and sometimes things get shortened. So it's important that you know how to take it. Another important thing that you want to make sure that you're doing is make sure you're storing your medications in a dry place in your home that it's room temperature. A lot of people typically try to put their medications in a cabinet in their bathroom. Well, what do? We take showers and baths and we create humidity, and that's not good for medications. And then other folks try to put them in a kitchen cabinet. Well, we cook in the kitchen, we create heat, and we don't want the medications to go through heat. So try to find a place in your home that's away from direct sunlight, that's at room temperature, but it's also out of the reach of children and pets. And of course, some require refrigeration, so make sure that if it needs to be refrigerated, that it is kept in the refrigerator. And when in doubt, ask. That's what we're here for. Pharmacists are, the most accessible healthcare provider that's out there. If you call a pharmacy, you can typically get a pharmacist on the phone in just a few minutes. If you walk into a pharmacy, you can get a pharmacist, have some face-to-face interaction within just a few minutes. So we're valuable resources for drug information, so make sure that you're utilizing that, because an informed patient will have better outcomes. Some don'ts that we need to make sure that you're not doing is avoid taking other people's medication. If you don't want to take something that wasn't prescribed to you, let's say, for instance, that you run out of your blood pressure pill, but your friend across town says, oh, well, I'll take blood pressure medicine, I can just get one from her to make it through. Well, that may not be the same medication that you're taking, so you don't want to set yourself up to have a potential drug interaction or an adverse effect, or something that you potentially could be allergic to. You also don't want to take any expired medications or any unused medications. A lot of times we take something and we don't need anymore and we stick it up at our cabinets. Likely they sit there for years and they become ineffective. And when we finally get in there to dig them out, we find that they've been in there for several years, and some prescriptions, medications become toxic over time. So don't let them hang around your house. If you don't need them, dispose of them properly. And we offer a service at the hospital where twice a year we set up to take prescriptions back from the public. You can also go into the Sultaga Police Department at any time and drop any unused or expired prescriptions off. They have an old mailbox that you can just walk into their office, drop it in, no questions asked, go on your way. So that's real important too, because you don't want to leave something around that somebody might get a hold of that's not intended for them. Also, don't alter any of your medications. Some medications, the thing that comes to mind are extended release medications. Those are made in a way that they gradually release medication over a period of time. Everything doesn't get released and absorbed immediately. And that's their purpose of how they're supposed to work. But if you alter them, you cut them, or you chew them, that doesn't allow them to work like they're supposed to. So always ask before you alter a medication. Some are fine to be chewed or crushed, not necessarily chewed, but or crushed if you need that, to be able to take it. But just ask before doing so. Also, don't change the dose or the frequency without talking to your doctor. When you do this, you could potentially get more or less than the intended effect. And that could be, if you get more than an intended effect, that could be, really hazardous to your health. And if you also don't take them like you're supposed to, you're not getting the full benefit from them. Also, don't stop any medications without talking to your doctor first. And another big important thing is don't use a spoon when you're dosing, especially if you're giving, something to a child. A teaspoon is typically 5 milliliters. But teaspoons vary in the amount that they hold. One company might hold 4 milliliters, another one might hold 5.5. So never use a spoon for dosing. They're not accurate, and you can always get an oral syringe or a dosing cup, either with a product or you can get them from the pharmacy. Kind of switching gears into medication adherence, that just means, are we taking our medications? And 50% of the patients that have chronic illnesses don't take their medications as prescribed. And the most important fact on the screen is 55% of our elderly patients don't take their medications like they're supposed to. And when you don't take them like you're supposed to get their intended effect, there's consequences. You can have a decreased quality of life, where you're taking the medications to try to, if you have high blood pressure, keep your blood pressure down. So you're not treating your disease state like you should be, which could lead you to a stroke or a heart attack or a blood clot. And we also take them to manage our symptoms. So if we're not taking them in the right way, then we won't be alleviating our symptoms. And also it could be life-threatening if you don't take your medications like you're supposed to. And another important point on this line is it increases the cost of health care to the tune of $300 billion a year. That could be avoided if people were compliant with their medications, and that takes up about 10% of our total health care costs. So there's a big emphasis from the Medicare side and the insurance company side is they want you to take your medications. Because one, it's going to benefit you and the most, and two, there's a cost of not doing so. This chart, there's a lot going on in this chart. There's been a lot of research to indicate why people don't take their medication. The first one I'll talk about is social and economic. The biggest thing that jumps off on this slide to me is cost. If a patient can't afford their medication, they're not going to take it. I don't care how late or great the drug is. If you can't afford to take it, you can't afford to purchase it, you're not going to take it. Another thing is the health system side. A lot of times people have long wait times when they go to the pharmacy, or their patient-doctor relationship isn't just what it should be. Hopefully we don't have any of those problems here, but that is a factor that's reported why people don't take their medication. Condition-related. Hypertension or high blood pressure is called silent killer because you don't really have any symptoms of it. But it's very important to take your blood pressure medicine because if you don't, you're increasing your your chances of having a heart attack or a stroke and put strain on your kidneys. And also therapy related. If any of you take warfarin or Coumadin, as you know, you have to have your levels checked on a consistent basis. And when you get that level back, you may have to change the way you're taking your medication. So that creates some confusion for patients from time to time. Patient related, we'll get into more of that in just a second. But a lot of times people just don't feel motivated to take it because one, they might be taking a few and they've taken it for a long time and just don't want to. So the top reasons why people are not taking their medications the way they should be. The first one is sometimes people have limited income. A lot of time our seniors are on fixed income after retirement. Some of them may have transportation problems. So one key thing that you can try to do to offset this is use generics when possible. Generics have to be shown to work, almost just as good as the brand name within just a couple of percentages. And I would always recommend a generic when it's available. And it's a way to help control healthcare costs and also, for you guys as well, that they don't typically cost as much. If you do require a brand name drug and you have problems affording it, most of the companies have a patient financial assistance program. You can go online and you can fill that out yourself, or you could probably get some assistance from your pharmacy or your doctor's office in that. A lot of times doctor's offices can provide you with samples, and also there may be a discount for a card or a program that you might can enroll in. Another big reason people are not compliant with their medications is forgetfulness. Dementia and Alzheimer's are contributing factors with this, but when you forget to take it, it leads to either over or underdosing, just depending on whether you took it or whether you thought you took it. I would also recommend using a pill box, and regardless of how many medications you have. That can help to offer a solution to you from forgetting to take it. And sometimes we just have to rely on the help of our family and our caregivers to help us make sure that we're getting the medications when we're supposed to get them. Some more problems that we see with medication adherence is medication-related factors such as you may have to take this prescription multiple times a day. Not everything you can just take once a day or twice a day. Sometimes you have to take it several times a day, and that just gets old over time. The potential or the fact that you do experience side effects. If you have any problems from a medication standpoint of taking your medication, talk to your doctor or your pharmacist and see if we can come up with some way to simplify your regimens or help you to remember to take them. Other things we see is such as vision problems. Like I going back to the little round white pill, you may have 3 or 4 little round white pills and don't know which one's which. If you have hearing problems, a lot of times it's hard when you go to the doctor's office or to the pharmacy to be able to hear what they're saying. Sometimes people report they have problems swallowing their medication, and that's especially where a pharmacist can come in to figure out some alternative way for you to be able to take your medication. A lot of times people report they have problems accessing a doctor or just a communication breakdown. So what is Coosa Valley going to do to try to help mitigate and come up with a solution for how we can just offset many of the things that I just talked about? So it was our vision of our administrators at the hospital to come up with a retail pharmacy solution for our patients so we can be able to meet them at their point of need. So we just kicked off Coosa Valley Apothecary, which is the pharmacy that's located right in the lobby of our hospital. It's, most of you know, when you come in the front door, the pink ladies sit at a little circular desk. Well, they're right behind it. So we welcome you to come to the hospital and to check us out. We just rolled out a Meds to Beds program, which is a prescription delivery service that we will be able to provide our patients, because we want you to be able to get your prescriptions before you leave the hospital. We want to know that your prescription needs are taken care of. We will be able to fill and deliver those at the hospital to your bedside before you go home. We accept all major insurances and able to set up any form of payment, cash or credit cards, and we'll process that at the time of delivery. We also have a $4 or $10 list that you can enroll in if that's something that would be beneficial to you. And if insurance companies allow it, we have a free mail-to-home delivery service for you. So this is something that we're very excited about, and we're very hopeful that it will be able to meet our patients at their point of need, especially from a prescription standpoint. We have with us today Nicole Gravitt, who is our pharmacist in charge and the pharmacist that will be running Coos Valley Apothecary. She also attended Auburn's pharmacy school just like I did. She was a couple years behind me. She graduated in 2014, earning her doctorate of pharmacy degree then. She has 4 years of pharmacy manager experience and currently lives in Childersburg. Wendy Martin, who's a certified pharmacy technician, who will be working in the pharmacy as well. She has 23 years of technician experience, so she's very good in taking care of the patients, and has been helping take care of our employees the last few years. And she's been with the hospital for 3 years now. And one new role that we added was a prescription care advocate. And the lady's name who's in that role is Pepper Pinson. She has 5 years of technician experience, and she will be the one that will be the liaison between the pharmacy and the floors, the nursing units, interacting with the nurses and the doctors and the patients to get those prescriptions and talking with the patients to see if they want to utilize this service before they go home. So at this time, I will ask Nicole to come up and introduce herself to you and let her tell you anything that she wants to about herself in the pharmacy.
Well, as already said, my name is Nicole Gravitt. And I graduated from Auburn in 2014, so 2 years after RD. I currently live in Childersburg, however, I'm initially from North Florida. So I moved here after pharmacy school with my fiance, now husband, David Gravitt, who is from Childersburg. If you go to CVS, you probably see him in there working at the pharmacy. But with the pharmacy, the Coos Valley Apothecary, what we do, like Artie said, we will be delivering, does this one not work? Maybe. Can you hear me now? Oh, okay. So the pharmacy has kind of two different roles. We do meds to bed, so if you were in the hospital and you're getting ready to be discharged, instead of having, give you the prescriptions, you happen to go to a Walmart, a Walgreens, a CVS, and wait on your prescriptions, we kind of bypass that route. We're able to take them while the doctor is maybe telling you about them, or the nurses are getting your papers ready. We fill them, and then we have them ready for you to go before you're discharged. So that saves you one step of, getting home. Because normally I know when you're ready to go home, you're ready. You don't want to have to go to a pharmacy, wait around, or have someone come back and get the prescriptions later. But we also will be able to function as an independent pharmacy. So say if you go to Walgreens or Walmart, we are able to do that business for you as well. And again, we don't take us so long to fill prescriptions. It would be just Wendy, myself, and Pepper sometimes. So it's a very small facility where we're able to treat everybody as an individual and as family.